Hello everyone, welcome to Talking Health with Dr. Laz, your favorite health program on television. Reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Yes, this October, a few days ago, Nigeria celebrated its 61st independence anniversary. We will say congratulations to Nigeria. And of course, the independence anniversary came with a lot of analysis from the security situation of the country to the state of our healthcare sector, and of course, everything that has to do with Nigeria. Of course, a lot of progress that have been made were recognized, but many are somewhat, not very happy with the mood of the country. And the medical profession itself is in one of its most, or should I say, the saddest moment. Given that on 1st October 2021, when Nigeria was celebrating 61 years anniversary, the resident doctors were also marking 61 days that they've been on strike, with many of the issues they highlighted not having been met. Of course, because of the strike, there's been a lot of turbulence, if I must use that word, within the medical profession, especially between resident doctors and the leadership of the Nigerian Medical Association. A lot of resident doctors feel that the NMA has not quite handled the issue of strike, where they felt they were not really representing their interests, with even some going to the extent of demanding the resignation of the NMA president. But of course, the NMA, Nigerian Medical Association, says that because of the plight Nigerians are facing, they feel that there could be better ways of resolving the issues without continuation of the strike. But this is not the subject of our discussion today. It's our hope that issues of strike in Nigeria is permanently resolved, for it not to happen again, not just in the medical profession or the health profession, but in every aspect of our national life. Also, during the period last month, something good happened on 30th September. The federal government of Nigeria launched the Nigerian vaccine policy. Recall that issue around local vaccine production became much more topical since last year, when Covid19 pandemic disrupted the supply chain system of the country. In fact, not just Nigeria, but everywhere in the world. So, local vaccine production, note that Nigeria used to produce vaccines even in the 80s and 90s, but in 2021, we are not producing any. So this Nigerian vaccine policy will help to guide investors and provide policy framework, for not just local production, but other issues that has to do with producing or even bringing in vaccines into the country. Also, I was privileged to participate in a conversation in the previous week, Nigeria Economic Summit Group, around issues that have to do with local manufacturing. And many speakers, actually say that the exchange rate issue is a big challenge because of how unstable the Naira is actually affecting investors. The availability of active pharmaceutical ingredients, APIs, for local manufacturers, and so many other issues. It's our hope that the relevant authorities should be able to resolve these issues so that Nigeria, by 2030 at most, should be able to produce all its medicines without having to import any. That's not just going to help in ensuring availability of commodities in the country, but also, help in creating jobs and making our currency stronger. So many issues to talk about, but today we'll be looking more to issue that came up a couple of weeks ago when the United Kingdom came up with a policy. In fact, it actually made changes to its international travel policy related to the COVID-19 pandemic. In those changes they made, they said from 4th October 2021, they recognized certain countries where if you take COVID-19 vaccination, you are considered as fully vaccinated. And there are also some regions of the world, including Africa and Nigeria, where even when you have your full COVID-19 vaccination, while entering the UK, you are treated as if you've not even been vaccinated. So that created a lot of response, very negative reactions, especially from Africa and many other countries that are affected by this rule. The African Center for Disease Control issued a statement. We're going to be talking more about that with my guest in the studio after the break. But also after the break, I will give a call to a cancer advocate because October is Breast Cancer Awareness Month, just to find out the expectations from those in the cancer space, the advocates, the medical practitioners and professionals on what we should expect, the conversation and the issues we should look forward to discussing this month as awareness around cancer gets much more pronounced. Do stay with us. You will see that today's program so much packed, a lot happening in the health sector, and very quickly, so we'll keep bringing them to your screen, and we hope that you keep staying with us on this program. We'll be right back after this short break. Yes, you said that there's so much we have on the table in the health space. Yes, there's a whole lot of things. And of course, this month is the Breast Cancer Awareness Month. But today, our discussion will focus mainly on these COVID-19 issues of vaccination, travel rules, especially involving some European countries and the United Kingdom. Yes, with me in the studio is a pharmacist and a public health professional. He's also been a fan of this program because on social media he's one of our most active persons who have been engaging us and promoting the show. You are welcome to the program, Emmanuel Okala.
Nice to meet you, Dr. Laz.
Yes.
It's a pleasure.
Yeah. Okay. COVID-19 pandemic has kind of introduced a whole lot of issues, and the most recent one is the changes to international travel policy that the United Kingdom made, where instead of recognizing vaccination based on the science, it now appears that it's based on geography. So if you took COVID-19 vaccines in certain places, you are considered as vaccinated. If you take it in some other places, they treat you as if you are not vaccinated. So, of course, there is a further explanation that the British High Commissioner in Nigeria, provided also a few days after the African Center for Disease Control, raised some concerns and, in fact, they practically expressed their reservations with those policies. So can you speak to this issue happening at this particular time?
Okay, thank you very much, Dr. Laz. First of all, I want our viewers to understand that the vaccine you take in Europe, in America, Oceania, Asia, and in Africa are exactly the same. We need to understand that. So I don't know how the same product that I take in the UK, it's going to elicit a different effect from the one I take in Africa, as long as that vaccine meets all the standards. And I think there's a little bit of politics to it from my own point of view.
What's the politics about?
Yeah, the whole COVID issue has been able to solidify some of the conspiracy theorists around migration.
Okay.
Yes, so I think there's some politics to it, because if you even follow the trend, the US does not even recognize people who are vaccinated from the UK. UK is a red country in the United States. So people who want to go to the US from the UK have to travel to the non-red countries and stay there for 14 days before they now cross over to the US. So you see, this politics has been there before this current one that affects Africa.
But then we argue that they want to protect their citizens.
Yes, it's good to protect your citizens, but at the same time, it's not good to throw away the baby with the bathwater, because people who are traveling have genuine reasons why they are traveling. And this is a pandemic. It's a global issue that requires a global approach, a global strategy. And so if you start segregating people, then you're not helping the situation. The poorer countries need the richer countries to help them. So if you start segregating the poorer countries, then the problem is going to be there forever, because you cannot limit human movement. People must move. So all you need to do is what? solidify your borders and ensure that people who are coming have genuinely received the vaccines. Yes, it is understood that people are falsifying data. But then, I always give this scenario. People falsify visa to travel. So if they get caught, does that mean you're going to say all people with valid visa should not come to the UK?
Right.
So that's not a proper approach for me. And I think, thank God for the African CDC who have made a solid advocacy for Africa, and I must commend them. And I think our leaders also need to step up. They need to sit up. We need to speak for Africa.
So with that advocacy, has it changed anything in terms of the policy that the United Kingdom made?
I think so, because there have been some little migration from what we thought it was. Yes, and you know, from October 4th, they're going to have just 2 categories of countries. Either you are red or you're not red. You know, we used to have amber, we used to have so many categories, yes. So from October 4th, their new policy states that it's either you are a red country state or you're not a red country state. And so those people with red country state are still barred from coming in, and others will be treated as such. So as long as you receive a vaccine that has been approved by the European Medicines Association, which includes the AstraZeneca, the Pfizer we are using, Johnson & Johnson, and the Moderna. They fall into this category. They have been approved by the European Medicines Association.
You're right.
So that is what we take in Africa.
So what that means is that regulation they made that if you're coming from Africa, you have to do the pre-travel test, the day 8 test, and you're also going to quarantine for 10 days
yes,
on arrival into the UK. Does it mean that that no longer applies?
No, the quarantine laws are still going to apply, but your vaccination status is going to be recognized.
Okay,
that's
but what of those, for those who are coming from places they assume they've been vaccinated, they don't go through those quarantine?
No, it's just different. The quarantine policies are there, but the number of days you quarantine. If you are coming from a green state, a green country, you are allowed to stay at home and quarantine. Okay. Yes.
So if you are coming from...
Yes, you're going to have to pay levies, more money. That means it's compulsory for you.
But that's still discriminatory.
It's discriminatory. It is. That's all we're saying. It's discriminatory. Why discriminate?
So, but some say that could it be because there are reports here in Nigeria, even from some investigative reports, that people get immunization cards without getting vaccinated, without receiving the shots. So that could have possibly made many countries in Africa, or Africa as a continent, to be put into this list. Do you think, if that is true, that these things happen, do you think is enough reason to make this discriminatory policy?
There are people in the UK who give fake vaccination passports, and they have been arrested recently. So it's global. Criminality is global. People do these things for survival. But what we must understand is the system that checkmates your vaccination status is very robust. You cannot generate a fake QR code in the database with a fake card. So you will be busted at the airports, either at entry or at exit. You will be busted and you will be apprehended and you will be arrested. So treat criminals as criminals and let others be treated as people who are doing the right thing. You cannot generalize. That is the problem I have.
Right.
Yeah.
In other words, I don't think much progress has been made on this. But some were suggesting that, okay, if the UK does that to certain countries, there should be reciprocal diplomacy. You know, Nigeria should also do its own list and put the United Kingdom, you know, for those coming from there to be considered as not very well vaccinated. Is that something you agree to?
Yeah, I think we've always reciprocated in recent times along the diplomatic front. Whatever you do to us, we do to you. If you remember the Emirates issue, yeah, when the Emirates says they were not going to fly Nigerians, yeah, they were banned. They were banned from flying. Yeah, we stopped people coming from the Emirates into Nigeria. So you have to go from the Emirates probably to Egypt or somewhere else before you come into Nigeria. So I think, but reciprocating is just going to worsen the situation. That is the truth of the matter. Because at the end of the day, everybody is going to be blind. So we need to find a middle point. And what is that middle point? Global equity for vaccine distribution. Because
vaccine equity.
Vaccine equity. It is very important. As we speak, Europe and the Americas have over 1 billion vaccines in reserve.
But one may argue that even the ones that is brought to us, we've not even exhausted it. And there's a lot of hesitancy.
Yes, vaccine hesitancy, yes.
You know, so there's a lot of people who don't want to take these vaccines. You know, some persons, I got a call some days ago that some persons took vaccines to a village in my community, and of course, without doing the necessary things that you do in public health, you must involve the community leadership, you know, convince them, and they will be the ones to call the people, you know, to come and receive whatever you're coming with. But in this case, people just went into the village, you know, with COVID-19 vaccines, and it caused a lot of pandemonium. People were running health asks, making calls that some persons have probably come to, you know, harm them, that they've seen all sorts about the vaccine, so they are not, you know, it caused a whole lot of confusion. You know, that level of reaction wouldn't happen to polio and some other vaccinations that we've gotten used to. So what do you think we need to do? Because the problem is not just about we not having enough to vaccinate our entire population, but even for the ones you have, people will tell you how much, I'm ready to pay, give me the card, but I don't want the vaccine. How do we solve this?
Yeah, I think vaccine hesitancy is not unique to COVID. We must understand this. It took us over 20 years to get Northern Nigeria to accept oral polio vaccine. Over 20 years of advocacy. So the key is just advocacy.
Advocacy.
We need to keep advocating. Advocate, advocate, keep advocating. Our political leaders, spiritual leaders, and all the other leaders we have need to understand that vaccination is the #1 lifesaver globally for the last 100 years.
Okay, so we'll take another break, but when we come back, I would like us to speak more to the local production. The National Vaccine Policy was launched just a few days ago. Perhaps you may not have read a copy, but you know, just issues generally affecting local production of medicines and vaccines in Nigeria and Africa at large. Do stay with us. We'll be right back after this break. Welcome back to Talking Health with DrLaz, your favorite health program on television. Yes, I've been with pharmacist Emmanuel Okala, who is also a public health professional, and we've been discussing COVID-19 vaccination issues and the global response to it, especially the recent changes in UK travel policy, where some countries and the entire African continent was being treated as if you are not vaccinated, even after taking the COVID-19 vaccination. And I want to read, you know, part of the African CDC statement. You know, it said the African Center for Disease Control noted with deep concern the planned changes to international travel within the context of COVID-19 pandemic communicated by the United Kingdom government. According to them, the new rules will discriminate between recipients of COVID-19, not based on vaccine received, but on the region in which these vaccines were received. So, and in that statement, they mentioned that it will result in significant and financial burden to travelers from African countries. And it will also include the pre-departure and the 8 tests and quarantine for 10 days for people coming from Nigeria and other African countries. And the sources provided no further explanation for rationale for this decision. And of course, it took effect on 4th October 2021. So it's, and one of the deep concerns it has is that it will further, you know, strengthen the vaccine hesitancy, because people are now saying that perhaps the vaccine they donated, recall that UK government donated vaccines as part of the COVAX, you know, facility. So perhaps the vaccine they donated to Africa is not the genuine vaccine, because if it is, why would they now treat us as not being vaccinated?
Yes. So that is the risk of that kind of statement from the UK government. Because now you are solidifying the conspiracy theory that what they are giving over there is different from what we are taking over here. And that's absolutely false.
Okay, so now coming to local vaccine production and production of local medicines. there's been a lot of conversation. Recall that in 2016, 2017, there was this memorandum of understanding between the federal government of Nigeria and May and Baker.
Baker, yes.
In fact, around 2005, they had an MOU, so they just activated it. You know, at a recent engagement, you know, I put a question. When will we begin to produce our vaccines? You know, in fact, especially to May and Baker, and they sounded something around within the next couple of years, you know, say around 2024 or thereabouts, you know, that could start because the infrastructure and a lot of things has to be put in place. Then at that same meeting, the AFDB, African Development Bank, you know, also within the context of COVID-19 have been seen on how to support countries to increase the production. So different regions, some countries have been mapped as priorities where there will be some support. Then large production will be done and of course distributed to other countries. The goal is by 2030 for there to be at least say 60 to 80% of local production. So as a pharmacist, how do you think we can make significant progress in the area of local production of not just vaccines, but other forms of medicines?
It's so sad that we used to make vaccines and we no longer do. So that's one of the saddest things of this story. It needed a pandemic of COVID proportion for us to begin to think again that we should actually be producing vaccines. That is one. Then two, what proportion of our budget goes into R&D?
R&D means
research and development.
Research and development.
You can't just walk into the lab and say you want to start producing vaccines. Years and years of research goes into this this aspect of health.
But do we need to reinvent the wheel? What about the researches that have been done elsewhere? Is there no way of transferring such?
90% of the researches done elsewhere are based on imported technology.
Okay.
We are now talking of local content. We have so many products, pharmaceutical products in our forests and around us that we can synthesize to some of these products that can produce some of these local vaccines.
Okay.
But we haven't even identified some of them. So we need to delve into local technology and local sourcing of raw materials for us to be able to make progress. You just talked about the forex, the foreign exchange. It's a big problem.
And I was coming to that because financing is a major issue. And you talked about what do we have in the budget. But beyond the government budget, what about the private sector? You have over 100 local pharmaceutical companies here in Nigeria. And most of them, I've had a guest from PMG Man, the executive director of Pharmaceutical Manufacturing Group of the Manufacturing Association of Nigeria, who said, based on government policies that are not very conducive, that it actually makes importation
cheaper,
more profitable than producing in country. So what are those issues? There are issues around APIs, issues and also the global politics around this. Some people believe that some parts of the developed countries wouldn't want us to do our local vaccine production because, and not just vaccine, local production of medicines, because that is going to reduce demand on the one they are producing in their countries and has economic implications for them. And they will keep, making the rules tougher at this perhaps international organization level to make it tougher for local companies to be able to meet those rules that will make them being recognized. Do you agree with such postulations?
I don't, because China, which I like to use as a model for local production of herbal medicine, the West will do everything to ensure China doesn't make it. But they are. So why can't we? You create your market for yourself. The government...
and India as well.
And India, yes. And India and smaller countries like even Vietnam are making progress in pharmaceuticals. So the government needs to play their part. The private sector will not bring their money into space. Infrastructure. Power alone is enough to kill your business.
Okay, so we're rounding up now. Yeah. In specific terms, 1, 2, 3, 4, what are those actions you expect from government and other stakeholders? 1,
produce critical infrastructure for manufacturing, vis-a-vis power and the rest of them. 2, harness our manpower, stop the how do you call it, intellectual people running away. Brain drain, yes, that's the word, brain drain. Stop brain drain and keep your best in your country.
Okay.
Number 3, copy models that have worked globally. I just talked about China. We can go there and learn. China has a massive university just for herbal medicine.
Is it just to copy or to adapt?
Or to adapt, yes, that's the word. That's the key word, adapt. And then number 4, have short, medium, and long-term goals on local production.
Okay, so let's hope that with the launch of the national vaccine policy, that is going to fast-track efforts. At least there is a guiding national policy that, guide all stakeholders on the interventions. All right, that's the much we can take today on the program. But before I round up, we want to really send, our heartfelt messages and condolences to various families that may have lost their loved ones over the various issues on every part of the different parts of the country in the recent past. And keep encouraging ourselves as citizens and patriots. The Nigeria we want will be possible through us. No external person will build the Nigeria of our dreams. So no matter the situation, let's not lose faith. Let's keep doing our best in the health sector, in other sectors of the economy, to build the Nigeria of our dreams. Together, working with love, and love for country and love for self, Nigeria will get to the right destination. So we'll meet you again, same station, same time next week on this program. Thank you for being with us. My name is Dr. Laz Eze. Bye for now.